Why is implementation research, IR, important for the health systems in low and middle income countries?
Implementation research is of key importance for health systems, especially in low and middle income countries. And despite the advances in the Sustainable Development Goals, yet the health-related SDGs and where low and middle income countries mainly exist, they lag behind. I mean, our health system, to start with, is complex. And LMICs are faced with the double burden of diseases, are faced with global warming, are faced with many factors, including conflicts, man-made disasters, earthquakes, floods, especially in the recent years. So how our historic or traditional health systems function can no longer be the case. We have to adapt, modify, and build back health systems that are more resilient and fit for purpose and fit for practice. And I believe that can mainly be achieved through understanding the context, through developing interventions that are contextually relevant with the people, through the people, to enable their sustainability and success. Hence, the importance of implementation research, bringing those teams together and absolutely enabling our health systems to thrive the way they should.
Which skills are most crucial for effective outcomes in IR teams and why?
IR teams do bring together a range of skills and competencies where each team member is key. They bring in their special set of skills and competencies. However, if I were to choose the most vital to strong outcomes, that would be policymakers. You see, their presence in an IR team enables political commitment and government buy-in. Policymakers act as catalytic agents to the broader health system stakeholders, where they have access to key players and decision makers that can enforce implementation research interventions and facilitate barriers. So policymakers should and have to be on the table. In IR, the problems are real-life problems. They're bottlenecks within our health systems that require immediate, effective attention. And therefore, policymakers won't be far away expecting the results and looking into return of investments of the resources that they had spent or advised on. Therefore, policymakers will be inclined to see why things aren't going wrong and trying to understand that. Now, by bringing them on the table from start-go, as we do in implementation research, and explaining the bottlenecks, explaining the problem, and working with them as part of the team to build that evidence, share that evidence with relevant stakeholders that can absolutely enable then the intervention proposed. And absolutely, they're a game changer, especially in low and middle income countries in our health systems. Political commitment and buy-in brings and takes projects a long way ahead, where we find that, unfortunately, although some IR projects are very well designed, the intervention is very much appropriate and context-specific. However, without that buy-in, without that extra push, then we find that they unfortunately do not reach the result, the end aim that we wished for.
What are the benefits of IR Self-Assessment Toolkit?
I'd absolutely recommend the use of the IR self-assessment tool, especially for teams, as I mentioned, that are considering implementation research. You see, it acts as a roadmap identifying the different aspects of the IR process, from working with stakeholders to drawing together the right resources to build your implementation research team, to the design and plan of the IR project. And furthermore, it assists IR teams in identifying their capacity on the scientific inquiries, from formulation of the IR question to choice of the appropriate research methods and conducting IR in a robust manner. So it focuses on implementation strategies, the designing, the intervention with full understanding of the context. It brings their attention towards the importance of understanding their health system, understanding the community setting for which they will intervene to counterview, and absolutely communicating and advocating effectively through the IR process. So through this self-assessment framework, it already draws the key principles, stages, and steps of implementation research and enable the team that are thinking about starting an IR project or are already did. It's always useful to go back and see from our previous IR project, how did we build our skill set? Who do we need that we did not include in our previous IR project? So it acts as a reminder for the IR team to always visit when commencing an IR project.
What's the valuable feedback from users of the IR competence framework and online tool?
So the self-assessment framework was built. It contains the key principles and stages of implementation research. However, it will always benefit us to know better how the different IR teams are reacting towards the self-assessment framework, what it misses, what should be added, how it can be maybe changed, how it can be made more interactive, if there's stages that we absolutely go back periodic stages for them to use. So that can absolutely then feed back into the current self-assessment framework and enable us to better design, adapt, and contextualize. You see, it's all about implementation research. Even when we're speaking about the self-assessment framework, it is an IR process where we're eager to better to contextualize and to make it speak absolutely to the need of the audience.
What does IR mean to you?
Implementation research absolutely made things happen, irrespective of the health system problem you are dealing with. You will find that the fruits of IR bring the success and exemplify and showcase it. So it's not the fact that we're only producing, which is important, new knowledge, new information, new learning to the scientific arena, but we're giving back to the communities. We're including everyone and engaging them. That enables the sustainability, it enables the ownership, and also feeding back into the different stages and layers of our stakeholders and bringing the team back together, making it matter and showcasing it and seeing the successes and the achievements of IR, and learning also, because it's a real life situation and we're dealing with life settings, we're dealing with real people, we're dealing with the scenario A, B, C, D till the end of the alphabet. It's not well controlled as we do within our labs, but this is the reality. And I believe together we can absolutely make it happen.